First of all, I guess a chance to reflect after Thank You Week. We spoke last week when myself and Tom were on, really about that opportunity. We don't often do it, which is to really appreciate the thanks that we've had from our colleagues, from friends, family, and also from each other, along with some of the celebrities who were able to share their thoughts. We still think the Norwich City goalkeeper Tim Krul was the biggest hits out of all of that, which was probably a surprise to a number of people, probably especially Ipswich Town fans as well. But I won't say any more of that, and I need to stay apolitical during sessions like this as well. But I think if you do step back, it's really important. COVID is not over, and we know COVID's not over. But we have seen in the last 2 weeks, reported nationally, just some of that pressure starting to ease very slightly. What we've seen for us as a trust is we've seen that pressure move up from really the south of the patch around Essex, Hertfordshire, the London border, all the way up now to Norfolk, and it's really Norfolk where it's pinching at the moment. But what we've been able to do is that thank you, and that thank you very much from people outside of the NHS who've really taken the time. We also saw that last night as well, and from a resident within our patch, so in Bedfordshire, Captain Sir Tom Moore, who passed away, and you'll see that the trust in the NHS have recognised that, and we've had our trust flags at half-mast. Really important because we have benefited, or we have the money to benefit from the work he's undertaken. Earlier in the year, we've got over 120,000, which we're currently working through in terms of the well-being and support of yourselves, and that was one of the key kind of asks and raising the money as well. So from our point of view, I do thank you for that, and it's really kind of important for us to be able to continue to reflect on that, and the reinforcement really of how people view the NHS and how people feel within there as well. The other bit I'd like to just cover is around the work around our vaccination programme. So thank you for all of you who have had jab number 1, so the first vaccine. We're now working to plan the second vaccination, which will start in March. We're looking at trying to do that from kind of week 10 rather than the 12 weeks, because that gives us some tolerance in terms of progressing with that. So it'll take us towards the end of March onwards for that second phase. People can still get their first jab, it hasn't closed, so I would ask you all to have a look, keep an eye out, keep asking and keep searching in order to get those vaccination undertaken. A lot of the thought process behind all of those is really around kind of trying to build both individual and also then what people may collectively refer to as you build herd immunity, i.e. enough people have enough kind of resistance or vaccination to it and response to it, and allows us to be able to continue and really, I guess, start to think about how we are emerging from the pandemic. Additionally, we also need to think about what that will mean for us as an ambulance trust. So atypically from the rest of health and social care, we kind of never really stop doing stuff. So it's not very easy for us to turn things off and to say we're going to stop doing things. People always keep calling, and therefore that's what we've seen. So with that in mind, we now start to move towards what Easter and also summer will be for us before we move into winter. So for me is thank you for everything that people are doing, and we know we're going to have to keep going as well. The other bit I think it's really important in terms of encouraging people to get the jab is also from our BAME colleagues in the trust as well. You know, we are making good progress, but actually we can always do more on all of that. So we'd absolutely ask our BAME colleagues if they're listening, and for people to have conversations, because actually it's okay to have a chat and to talk about whether people have had the vaccine, to actually encourage that uptake as well. We know from the early early figures and the early thinking, particularly within for me related to I guess the impact of BAME colleagues, it's a really important group that we look to support and keep well. And the idea behind all the vaccination effort is that it absolutely looks to keep people well, protect themselves, protect others, protect family, and protect our patients as well. So we're probably we are probably kind of just over the 75% mark, and I think that's really important to say, look, we're doing well, but actually keep going with the vaccinations, they will be there. So thank you. So what I want to do now is bring in John. John's got some areas he wants to talk to you about, I guess an update on our kind of people and some of our progress and areas that are also important as well. So thank you. I'll hand over to John.
Thank you very much, Marcus, and good afternoon to everybody. Thank you very much for dialing into this Q&A session. I think, all due respect, probably only a coup could be talking about next winter when we're still in this winter in terms of timescales. I just do want to revisit very quickly just the final point that Marcus was making around vaccinations and particularly ensuring that everybody in the trust has the opportunity to get a vaccine, and that everybody that we make sure we cover all of our different staff groups. There was a very interesting and informative webinar last night, which I know a number of the trust colleagues attended, around ensuring that our BAME colleagues both have access to the vaccine, and that unfortunately we have been seeing across the entire country some misleading social media and other messages that are particularly targeting either people of a BAME background or potentially people with very strong religious affiliations, trying to discourage them from taking the vaccine. So that is something we'll be looking at as an organisation, see how we can counter some of those false and very unhelpful narratives around vaccinations. So moving on, hopefully everybody on this call will have received their pulse survey. So in addition to the national staff survey that runs every November, the trust has teamed up with Pickers, who are the external organisation that run the pulse, the national staff survey, to do a series of short pulse surveys. So these run quarterly. The last one was in August. The current one is out now and finishes on the 12th, so next Friday. It is a short survey, so it's not too many questions long, but it is very much focused on some of the areas that, as a trust, we are hoping that we will see improvements on in terms of our culture. And also there's a very short module in there asking people for their reflections on how the pandemic has affected them, and how the trust as an organisation has both supported staff and dealt with the pandemic. And we've included that module again because, sadly, as we know, the pandemic is still very much with us, but trying to get an understanding, take some learning from our response to that pandemic is really important. So if you please have a check in your inboxes for a pulse survey from Pickers. It's not too many questions. Really encourage everyone on this call and your colleagues to fill that in. Linked to that, we are shortly going to be getting the final feedback from our 2020, so sort of October, November 2020 national staff survey. So there's a whole bunch of rules around how we can share the data for the staff survey. So a lot of it is embargoed, so you can't share it in many forums until the end of February. But there are a few headlines that we can share and that have come out from the staff survey that we've had. The first one is actually we've seen an increase in response rate. So many of you on the call probably remember that in October and November we were also running our trust harassment survey, and we did put a lot of emphasis on making sure that people were aware of that and had the opportunity to fill that in. So we didn't really quite put as much emphasis on the national staff survey as we have done in previous years. Despite that, we did see an increase in response rate to nearly 50%, which is only a little bit higher than it was last year, but quite significantly higher than it has been in previous years, which was very pleasing to see. In terms of some of the key themes that have come out through that, we are definitely seeing a degree of consistency, both with what we saw in the CQC report and also in the harassment survey, which I think indicates that people are willing to share their experiences and their views, which is really positive. And it's another really good data source to triangulate with the other bits of information we have to inform our cultural journey. And that's another reason why the pulse survey is so important for people to fill in, because it gives us an indication of, are some of the actions we're taking, are they having a positive effect? Are they not having a positive effect? Do we need to change what we're doing, or are we on the right track? So some of the bits that will come out from the staff survey, and something that we're doing already that came out very clearly from that, is we set up a working group to have a look at how the trust organises ourselves when it comes to acting up and secondment arrangements. So that's something that has come out through a number of sources, not least the staff survey, to say that there is a perception, and I'm sad to say, I think in some cases a reality, that the processes that the trust follows in terms of who goes into secondments and acting up, how long those last, how they're refreshed, don't follow the processes that we would want to see and aren't as dependent on kind of appropriate processes and a meritocratic approach to selection as they should be. So that is absolutely something that both the perception and in some cases the reality is something that we recognise. So we have been making a few procedural changes immediately around the process that needs to go through and the length of secondments, but we are working with a variety of stakeholders, including trade union colleagues, to make sure that the process that we have in the longer term is the right one, and is fair, is transparent, but also does provide the opportunity both for individuals to go and get more different experience, which is really useful, but also fulfills the organisational need that we sometimes have where we have to move people around at short notice because we have operational pressures that need to be covered. So that's, I think, just one example of some of the action that's being taken following the staff survey feedback. In terms of some of the other points from the staff survey, normally what happens with a staff survey, we get the results, we ask each area to do an action plan, they follow through on their action plan, and then we try and review it and get some positive change that way. I think what we're looking at for this year is maybe a slightly different approach. The trust has done a number of staff survey action plans over the last number of years, and I think the fact that we've had the CQC report that we've had the feedback through the National Staff Survey, the Bullying Harassment Survey, feedback from trade union colleagues would indicate that we haven't seen the changes that we would want to see through that approach. So as we have a more longer term and holistic cultural change programme going on at the moment, we will be looking to align the feedback that we've had from the staff survey to the actions that we're already doing, rather than duplicating a whole additional set of actions through that. So there will be more information coming out as we get, because we haven't quite had all the information back from pickers yet, but we will be publicising some of the good and some of the bad from the staff survey shortly, and kind of how that aligns to and how that supports some of the work that's going on. So that's what I want to say around staff survey. In terms of some of the other things that are happening at the moment, we have been able to welcome a couple of new individuals into our wellbeing team in recent weeks. So we've got some additional capacity in there, and we're working very closely with our partner K's in terms of the range of services that they offer, and also to try and streamline and improve the electronic referral process that we've got there. Also, another piece of work that should be coming through shortly is to highlight in a much more hopefully user-friendly way some of the external and internal sources of support that people can access. There are a huge variety of different internal and external sources of support, so much so that I think the guidance documentation runs to something like 17 pages. So trying to distill that and make it really clear to people kind of where the best sources of support, depending on their requirements, are, is a piece of work that's going on. So do keep an eye out for that, and as we're getting some more resource into that team, I think we will be looking at refreshing and building on the wellbeing offer that the trust has. Finally, one of the things that came out from the CQC report was a requirement for the organisation to undertake a review of the capacity and capability of the Workforce Directorate, and I'm very pleased to say that work is now started in earnest. So making sure that despite the extra capacity, which has been fantastic, we have been able to bring in over recent months, to make sure that we have a robust, appropriately resourced and appropriately skilled workforce directorate to be able to support the organisation going forward. Is really important. A lot of the cultural work and improvements we want to see are underpinned by the support and being able to support line managers and staff in having the confidence and the skills to be able to resolve issues when they arise, to be able to contribute to people's working environment and working lives, and being able to, unfortunately, when they do happen, try and find speedy and fair resolutions to workplace issues. So that work has started. It's going to take a little while to work through all the minutiae within EAST, but I think it's a really positive step to be able to bring that external expertise to bear.